and welcome to week 1 of the Lynn Literature Searching MOOC. I'm Michelle Maiden and I'll be guiding you through the weekly MOOC content. This first week is all about how we get started with the literature searching process, and in particular, how we go about gathering enough information from the person or user requesting the search in order to retrieve exactly what they want. Throughout this week, there are a number of exercises, reading tasks and quizzes along the way to help reinforce the learning experience. Asking the user who has requested the literature search the right questions at the start of the search process is crucial to informing the literature search. Defining exactly what the user wants at this initial point allows you to focus the search in order to identify the key search concepts and terms to search on. It allows you to identify the purpose and scope of the search, as this may impact on how much information is returned to the user. It also gives you a chance to clarify with the user your understanding and interpretation of the request, and to determine the time frame for undertaking the search and the format for the delivery of the results. By the end of week 1, you will be able to help the user focus the question for the literature search, locate suitable frameworks in order to help you focus your search request, and know what details are important to record when documenting your literature search request. The first thing to consider when you're asked to undertake a literature search is the type of question being asked. This is important as it will give you a good indication of where to start looking for the literature in order to fulfil the request. There are two main types of questions, background and foreground. Background questions are typically concerned with background or general information about a particular disease, condition, test or treatment, and they often relate to the physiology, etiology or prevalence of a condition or disease. Some examples of background questions are given on the slide. These types of questions can often be answered sufficiently using the medical textbooks or in the background section of conditions within point-of-care resources such as UpToDate or Clinical Key. Foreground questions are more concerned with aspects of care, treatment options and possible outcomes in relation to specific patients or situations. They often consist of 3 or 4 different elements relating to the populational problem, intervention or exposure, comparison and outcomes. Some examples of foreground questions are provided on the slide. We will cover these elements in more detail later on in this section. This MOOC will focus specifically on literature searching approaches to answering foreground questions using the healthcare databases. Before we can go to the databases and search for the literature, we need to know exactly what the user wants. To do this, there are a number of things we can ask them. Over this coming week, we will cover the following 8 basic steps in order to ensure that we obtain enough information to be able to undertake an effective literature search and locate exactly what is required. Step 1 is about asking the user to focus their request. Step 2 is about asking for search terms. Step 3 is about asking about limits that may be able to narrow down the focus of the search. Step 4 is about asking about the purpose and scope of the search. Step 5 is about asking about the time frame within which the search needs to be done and the format of the results to be sent back. Step 6 is about asking for a key reference that will help you scope your search. Step 7 is about asking for clarification and understanding about the request. And Step 8 is about documenting the asked request. So why do we need to ask the user to refine their request? Well, we need to refine search requests so that we know exactly what literature they want. This in turn will help us to identify the main concepts or ideas to search on, and also helps us to structure the search in the databases. One concern of librarians is that they don't often feel confident in asking the user to refine their request because they don't have a clinical background. However, it's worth bearing in mind that most librarians don't have clinical backgrounds, and it often takes years before they become more familiar with the clinical terminology. And even then, they still won't be familiar with it all. There's no need to worry. Refining the request doesn't necessarily require a vast knowledge of the clinical terminology, and it can be done by prompting the clinician to be as specific as possible when thinking about their topic. So how can we ask the user to refine the request? What tools are available to help you focus the search request? Well, there are numerous frameworks available to help you break down and refine the user's request in order to identify the key concepts to search on. Frameworks are useful as they act as a starting point when thinking about important concepts to search on, including those that the user may not have detailed in their initial request. They also help later on when we start to structure and combine the search terms together. One of the most commonly used frameworks within health is PICO, where P stands for population, I for intervention, C for comparison, and O for outcome. PICO helps us to focus the request by getting the user to start thinking more about the specific characteristics that relate to the population, intervention, comparison, and outcomes that they may not necessarily have considered initially. So if we start with the population, the types of things we're looking for here to prompt the user are who is being looked at, what characteristics of the population are important, what is the patient's problem, for example. Things to consider are age, so are we considering adults or children? Is ethnicity important? What about the condition or health status of the patient? For example, do they have a specific condition such as eczema or asthma? Do they have specific diseases, maybe cancer or COPD, for example? Or are they actually presenting with a particular injury that could be a fracture or wound infection? And is the setting important? For example, are you looking for literature within nursing homes, emergency departments, or primary care? Because sometimes research conducted in specific settings will be more relevant to that particular request. I stands for intervention. The majority of intervention type questions will probably relate to treatments or therapies, which may be pharmacological, that is looking at specific types of drugs, or non-pharmacological, such as physiotherapy or occupational therapies. However, an intervention may also be looking at a service, so the user may be looking for literature on whether to implement a new service, or it could be a new diagnostic test. However, the I for intervention is also slightly misleading because it can also relate to an exposure or risk factor, such as smoking. C is for comparison. Often when considering whether to try new treatments or therapies, clinicians will often want to know whether it is better than the existing treatment. It may be that the user wants to know if one drug is better than another drug, for example, at treating a particular condition, or whether one diagnostic test is better than another at diagnosis. Bear in mind that sometimes there is no comparison, so this won't always be relevant. O is for outcomes. Questions are usually asked because the user wants to find out something. These are the outcomes of interest. They may be patient-related, for example mortality, return to function, patient satisfaction or experiences, or they could be cost-related, such as cost-effectiveness, reduction in the rate of referrals or length of stay. Sometimes, however, not all elements of the PICO need to be present. It often depends upon the type of question being asked as to what elements are likely to be present. So in the next few slides, we're going to take a look at what we mean by question types and see some examples of how PICO can be used to frame each of the different types. When we talk about the types of questions, we're referring to the type of category that the question fits into. Most of the categories centre around caring for the patient. For example, when patients first present, we might want to figure out what is wrong with them, so we may ask questions relating to diagnosis. Once we know what is wrong, we may need to then ask questions about their likely prognosis, how we can treat or manage them, how cost-effective the treatment is, or the patient's experiences or satisfaction with the level of care provided. We'll take a look at some examples of the more common types of questions now and guide you through the process of how we can use PICO to focus the type of question. Let's start with treatment questions. So how do we identify a treatment question? Well, in simple terms, it's about what we can do for patients in terms of offering a treatment or therapy in order to bring about an improvement in their condition or state. Treatments or therapies cover a wide range of activities, from drug treatments such as ibuprofen and other clinical therapies such as sheepskin mattresses, to surgery such as total hip replacements, psychological interventions such as cognitive behavioural therapy, lifestyle changes, for example diet or exercises, social activities such as music therapy, or service-led interventions. Treatment questions may compare one treatment with another to see which is better, or it may not actually be comparing it with anything,